set up the sensor and supplies, and double-check that you have everything you need. Observe and locate key anatomic landmarks of the left chest, including the sternum, the left clavicle, and breast size. These factors will help you adjust sensor placement to the patient's body size and shape. Ask the patient about their typical sleep position, back, left, or right side, and about any occupational or other considerations that help you determine best sensor placement. The most important factor in sensor wear time and good ECG signal quality is thorough skin preparation. The patient's chest skin must be intact, clean, dry, and free of any oils, lotions, or powder or body hair before you apply the Solo sensor. Remove all chest hair growth in the area of the sensor placement on the left chest, including a full 1-inch margin beyond it. Use the provided application template to estimate the sensor placement area on the patient's left chest. Placement option 1 approximates the lead orientation of lead 2 of a standard 12-lead electrocardiogram. In this orientation, the sensor is placed diagonally and is the preferred position. For option 1, place the right electrode at the second intercostal space next to the sternum, and the left electrode at the third or fourth intercostal space. Placement option 2 is aligned with lead 1 of a standard 12-lead ECG. For option 2, place the sensor horizontally at the third or fourth intercostal space with the right gray electrode placed proximal to the patient's sternum. Avoid locating the sensor over the patient's left breast tissue or into the patient's left armpit. If needed, place the sensor closer in toward the patient's sternum and slightly higher. Cleanse skin with alcohol. Wipe clean an area at least 1 inch larger than where you're going to place the sensor. Let the skin dry. Use the application template again to locate the selected placement area. Mark 2 X's on the patient's skin that correspond to each of the holes on the application template. Next, mark dots or short lines along the outside border of the application template to identify where you're going to stick on the Solo sensor. Select one of the 2 provided skin abrasion pads in the patient's supplies. Rub gently only over each of the 2 X's marked on the patient's skin. This may cause mild stinging and erythema, but this irritation should subside. Wipe skin with dry gauze. Place the sensor on patient's chest. Holding the sensor with the clear liner side close to and facing the patient, unpeel and apply the first exposed gray electrode to the corresponding X you marked on the patient's skin. Press over and around this side in a firm smoothing motion, taking care not to wrinkle the outer adhesive border. Next, hold and pull to remove the remaining clear flap of the release liner, again matching the gray circle electrode area to the X on the patient's skin. Press around the white sensor cover firmly and smooth out the clear adhesive border against the skin. Lastly, with your index finger, trace around all sensor edges with your finger, smoothing as you go. Solo sensor activation. Ask the patient to remain still and press the sensor button once to activate sensor recording. If the Solo sensor's been activated successfully, you'll see the following. First, a green light will flash quickly for about 5 seconds. Second, this green light will turn off for another 5 seconds. Third, the green light will start flashing again in the same rhythm as the patient's heartbeat for about 10 seconds. Fourth, the green light will then turn off completely. Record the date and time on the patient's medical record immediately after the green light turns completely off. This is the patient's recording start time. You'll need to enter this information into the Cardia Solo software when processing the sensor electronics module for ECG analysis. The Solo sensor application and activation process is now complete. If you do not see the light sequence as described, or if you see an alternating red-green light flashing sequence, the device is not making good contact with the patient's skin and has not been activated. Press down again over and around the sensor and the surrounding adhesive. Wait a few minutes and repeat the button push above. Patient trigger. The patient should be instructed to press the sensor button if they experience symptoms such as palpitations. A green light will flash for 10 seconds after the sensor button is pressed. For best recording quality, the patient should remain still during and immediately after pushing the sensor button. Instruct the patient to write in the provided patient diary if they experience any symptoms and push the button, particularly noting the date and time.